Okay, let's jump right into this explainer. Today, we're pulling back the curtain on something you probably interact with all the time, but let's be honest, you probably never really think about it. We're talking about the electronic health record system your doctor uses during your visit. We're going to trace the fascinating journey of a single health data point, from the very second it's typed in, to how it's protected, and why it actually matters so much.
And why does it matter? Well, the ultimate stakes of what we are talking about are incredibly high. Think about it. A simple failure to document an allergy could result in an inappropriate, potentially life-threatening medication being prescribed. We aren't just talking about tedious administrative paperwork here. A single, meticulously recorded data point is, quite literally, a matter of life or death.
In the tech world, there's a really famous adage you've probably heard before. GIGO, which stands for garbage in, garbage out. And when we apply this exact principle to medical documentation, the stakes become exponentially higher. If garbage data manages to enter your health record, it leads directly to bad clinical decisions, poor patient care, and potentially disastrous administrative outcomes down the line.
Now you might be thinking that modern technology solves all our data entry problems, right? Well, consider this number. 7.4%. That represents the initial error rate of cutting-edge medical speech recognition software right before a human editor steps in to fix the text. It just goes to show how easily errors can slip right into the system if we aren't paying close attention.
That brings us to Section 1, the life or death data. Let's look at how we go from raw numbers to actual meaning.
The easiest way to think about this is the difference between raw ingredients and a fully prepared meal. By itself, a raw data point, like just the number 34, is entirely meaningless. But when we organize that number and give it some context, saying it's actually a patient's hematocrit reading, and then placing it alongside the normal healthy range of 34 to 46, boom, it transforms into critical information. And your doctor relies on that information, not the raw data, to treat you.
So where is this information actually coming from? Basically two main places. Primary data sources are the originals. It's you sitting in the room talking about your symptoms, or the direct observations your doctor types into your health record. Secondary data sources, on the other hand, pull from those primary records. Think of disease registries or massive databases used to conduct large-scale research or monitor population health trends, like identifying a specific region that has higher than average cancer rates.
Moving right along to Section 2, capturing your health story and structuring the narrative.
To prevent that whole garbage-in scenario we talked about earlier, software relies on very specific data capture techniques. Sure, unstructured free text fields are great for letting doctors type out long, detailed progress notes, but structured tools are often way better for keeping the data clean. Take a hotspot, for example. It's this handy pop-up text feature that appears when the cursor hovers over a field, giving instant guidance to help the physician select the absolute most accurate diagnosis code without having to guess. We also use highly structured data fields. So instead of letting users just type whatever they want, systems force the use of drop-down boxes, checkboxes, and radio buttons. Think about entering your address. If a system uses a drop-down box, forcing the user to select from all 50 states consistently, say choosing the full word Georgia rather than some people typing GA and others spelling it out, it drastically limits human error and ensures the data can be properly retrieved later.
Now let's look at Section 3, quality versus data integrity. It's all about usability versus trustworthiness.
These two terms probably sound pretty similar, right? But trust me, to a system architect, they mean very different things. Data quality focuses purely on the usability, reliability, and effectiveness of the data for making a decision. Basically, is it accurate enough to treat your illness? Data integrity, however, is all about trustworthiness. It guarantees that the data hasn't been altered in some unauthorized or malicious way while it's sitting in storage, being processed, or in transit. And honestly, both are absolutely essential.
To maintain these really high standards, engineers rely on a variety of behind-the-scenes tools. They use things like data dictionaries to standardize definitions, and something called metadata. Metadata is fascinating. It's essentially data about your data. It tracks exactly who created a file, when it was created, and even provides an audit trail of exactly who logged in to view it. We also have required fields, which literally stop a healthcare provider from clicking next on a screen if a crucial piece of information is left blank.
Okay, but I have to say, my absolute favorite tool here is the edit check. This is pre-programmed software functionality that automatically flags impossible human errors. So if a user accidentally types in a body temperature of 254 degrees, tries to document a hysterectomy for a male patient, or enters a completely illogical blood pressure of 543/87, the edit check literally stops the system and throws up a red flag. It acts as an incredible digital guardrail.
Which brings us to Section 4, the 10 quality standards, specifically looking at the AIMHA model. So who actually sets the rules for all this? Well, the American Health Information Management Association, or AHIMA for short, provides a widely used data quality management model. It's a highly structured framework that basically maps your data's journey through 4 major business processes: collection, application, warehousing, and analysis. And surrounding those 4 core processes are 10 distinct characteristics that dictate what actually makes data truly high quality.
Let's zoom in and break down 3 of the most critical characteristics from that model. First up is timeliness. This just means documenting the care right near the time it's provided, while the physician's memory is totally fresh so it doesn't get confused with another patient. Next is granularity, which is the level of detail. For instance, a patient being treated for complex cardiac disease requires a much higher level of granularity in their notes than someone coming in with a simple cold. And finally, accuracy. This simply means the data must be completely free of identifiable errors, because inaccurate data is useless, expensive, and outright harmful.
All right, Section 5, cleaning up the garbage and managing those inevitable errors.
Because errors are inevitably going to happen despite our best efforts, healthcare organizations utilize a rigorous process called data cleansing. It's a 5-phase technical process. Step 1 is profiling, where administrators hunt down where the data issues actually are. Step 2 is standardization, getting everything into an accepted, uniform format. Step 3 is deduplication, which is super crucial. It means removing duplicate patient files from the database. Step 4 is verification, double-checking the facts, and finally, Step 5 is automation and monitoring, to keep an eye out for missing or inappropriate data on an ongoing basis.
So what exactly are they looking for during this cleansing process? Well, administrators are constantly hunting for typos, illogical formats, and missing data, like an active patient file without a birth date. They also search for inconsistent data, like when one screen says a patient is male and another screen says female. And they absolutely hunt for statistical outliers. A great example from the source material is an administrator claiming 1,500 continuing education hours, when the normal range is usually between 20 and 250. It might not necessarily be an error, but it definitely needs evaluating.
And finally, Section 6, the human element, documentation integrity, and the serious risks involved.
Because at the end of the day, careless human keystrokes can bypass those digital spell checks far too easily. Remember, spell check only cares if you typed a real word or number, not if it's the correct one for the situation. Think about a completely correct physician order of penicillin 250 milligrams. If a hurried doctor accidentally transposes those digits, typing in 520 milligrams, the system might not catch it. It's such a simple, honest typing mistake. But the real-world consequences of giving a patient more than double their medication are incredibly severe.
But here is a number that is honestly pretty staggering. One study found that 46% of the notes written by a healthcare professional were simply copied and pasted from older records. I mean, wow! While doctors do this to save precious time, it carries a massive risk. You could so easily pull an outdated preoperative order or a long-resolved diagnosis into a current visit, completely muddying the patient's record and directly risking their current quality of care. So, as we wrap up this explainer, I want to leave you with a question to chew on. The next time you're sitting in that exam room and your doctor turns their back to type away on their screen, ask yourself, are your medical records just a messy, unverified pile of raw, copy-pasted data? Or are they a meticulously protected, properly structured, and highly accurate story of your health?